Greetings. My name is Dr. Rodgir Cohen, and I'm here today to discuss the suicide awareness and suicide problems with awareness in California. Suicide itself is the intentional taking of one's own life. On the one hand, suicidal behavior is a broader term that also includes self-inflicted, potentially injurious behaviors. Self-harm, though, is, while related to suicide, does not necessarily lead to suicidal behavior. There are many causes that are coming into play for the definition of suicidal awareness. The causes of suicide are complex and varied among individuals and across different ages, genders, and cultural, racial, and ethnic groups. The risk of suicide is influenced by an array of biological, psychological, social, environmental, and cultural factors that come into play. Within California, we have a problem with suicide. According to the California Department of Mental Health, suicide is the 10th leading cause of death in California. Regarding ethnicity amongst those who are counted in this study for suicide, the suicidal rate is the highest among the white population, and is reasonably higher than the state's average. For the American Indian population and Native Alaskan population is 12.5%, but while for Native Hawaiians and other Pacific Islanders, it's only 10.2%. The suicidal rate for people who identify as multi-race is at 9.5%, Black 7.6%, Asian 6.7%, Latino at 6%, and all those are below the California's average. According to the Pew Research Center in 2017, the highest rates of overall deaths due to suicide in California were concentrated in more rural counties. Suicide prevention among the youth must be one of the most important things that we look at for public policy in California. Although identifying the exact correlation between mental health services and suicide prevention is an ongoing area of study, the current body of research indicates that increased access to mental health care reduces suicide rates, especially when addressing the issue amongst the youth in California. The suicide prevention among the youth is seen in three different ways. Suicide is the second leading cause of death among adolescents and young adults between the ages of 15 and 24 in California. From the years 2016 to 2019, California is one of 7 states with the most significant increases in teen suicide rates. And from 2009 through 2018, the annual number of suicides of young and youth ages 12 to 19 in California increased from 163 to 188 people. So this number is severely high and shouldn't be this high. Research suggests that mental health care is a critical component of suicide prevention. Center for Disease Control and Prevention lists barriers to accessing mental health treatment as one of the risk factors for suicide. Multiple studies have also identified positive associations between access to mental health care services, such as a higher density of psychiatrists in a given area and reductions in suicide and factors leading to suicide. Over the years, the legislature has made several efforts and to combat youth suicide and self-harm. In 2004, the California passed Proposition 63, imposing a 1% tax beginning in 2005 on incomes above $1 million in an attempt to expand the state's county mental health services. In 2007, the legislature required that the Department of Health Services to establish a school health center and support children's program. In 2016, the legislature required all LEAs to adopt a suicide prevention policy addressing the needs of students in grades 7 through 12. While various organizations focus on youth suicide prevention and assist schools with suicide preventions, some of these could be people like the Trevor Project, and there are others that will train and equip suicide intervention for policies within California. I used to be part of Living Works myself as a program for suicide prevention. One that's close and dear to my heart is suicide prevention for veterans. As a combat veteran myself, this is a target area of people that I have concern for. One societal group severely exposed to suicidal problems is, of course, veterans. Due to the character of their service, the societal group can suffer from traumatic brain injury, known as TBI, or post-traumatic stress disorder, or PTSD. These disorders have been significantly increasing amongst older veterans, especially those who have seen combat for the last 20 years. There's an increasing number. The suicide prevention among veterans has seen the following. In 2013, the U.S. Department of Veteran Affairs released a study covering suicides from 1999 through 2010, and it showed that roughly 22 veterans died by suicide per day, or one every 65 minutes. Some sources suggest that this rate may be undercounting the suicides, while in 2013 analysis found that a suicide rate among veterans of approximately 30 per 100,000 a year compared to the civilian rate of 14 per 100,000, but this was not adjusted for age or sex. According to a 2016 report published by the U.S. Department of Veteran Affairs, they analyzed 55 million records from the Veterans Administration and found that between 1979 to 2014, an average of 20 veterans died daily from suicide. This number is astronomical. California has more veterans than any other state. Approximately 8% of all U.S. veterans live there and live here. Nationally, there was not a significant increase in veteran suicide rates. In contrast, in California, the U.S. Department of Veteran Affairs in 2018, the state data sheet showed a decrease from 614 veteran suicides, representing 15.3% of all suicides, and 1.2% of all veteran deaths, to 526 suicides per 100,000 people within the population. Despite the decline, the absolute numbers are still reasonably high, considering the total numbers of suicides in California is home to the largest and biggest veteran community in the entire country. According to the California Association of Veteran Service Agencies, the greatest percentage of veteran suicides, which is 54%, occurs among the 65 to 85 age group, compared to 16% of suicides of non-veterans in that age group. So there's a big difference in people in that age group. Similar to the United States, California's highest veteran suicide rate is in the rural areas, with 64% reporting gun ownership compared to 28% in the suburbs and 19% in urban areas. Another potential cause for having a higher suicidal rate in the rural area than in the urban areas may be the long distances to mental health care facilities or trauma centers. The high suicide rate among the United States military veterans has been a long ongoing phenomenon and raised concerns even in the 1950s when the first suicide prevention center in the United States was opened. During the mid-1990s, a paradigm shift started to happen in addressing veteran suicide. And it occurred by developing a national strategy that included several congressional resolutions. More advancements were made by 2007 with the Joshua Ombig Veterans Suicide Prevention Act. Statistics show that per the data from the National Center of Health Statistics in California during 2017 through 21, the number of people who died by suicide increased, though, and it has gone from 4,323 people to 4,436 people annually. So now we show that these statistics are increasing. Between 2017 and 18, the estimated number of suicide attempts increased from 108,075 to 112,275. And in 2017, over 1.1 million adults reported serious thoughts of suicide in California. And as of 2022, it is below the national average for suicide rates per 100,000. There are many initiatives and institutions that can support. Federal and state governments in California counties all play a role in governance and oversight of public policy and mental health services. The Federal Center for Medicare and Medicaid Services establishes and enforces minimum standards, but the states can expand those. Within the state and federal parameters, California counties have broad discretion how they fund and provide mental health services to target populations, including determining budgets and priorities. At the state level, several institutions are responsible for mental health policy in California. For instance, the California Behavioral Health Planning Council advocates for children with serious emotional disturbances and adults with serious mental illness, evaluating the public behavioral health system, participating in statewide planning, and advising the legislator on priority issues. Medi-Cal and other programs also cover 13 million Californians of low incomes. They provide mental health services through managed care plans, MCPs, the fee-for-service system, and county mental health plan. Mental Health Services Act programs are also part of these programs. In 2004, the California voters approved Proposition 16.3, creating a 1% surtax on personal income over $1 million in order to provide increased funding for mental health services. The suicide prevention institutions initiatives that are in place include the Department of Healthcare Services administrators such as Medi-Cal, the MHSA program, the Community Mental Health Block Grant, and these contracts with local mental health plans to provide specialty mental health services to children and adults on Medi-Cal. The Mental Health Services Oversight and Accountability Commission oversees the Mental Health Services Act programs and are responsible for developing strategies to reduce stigma, possibly advising the governor and the legislator on mental health policy. But I advocate for a free market solution. Neoliberalism capitalism not only increases distress and contributes to the rising rates of psychiatric disorders, but also dictates how we diagnose and treat mental illness. The for-profit healthcare system and the pharmaceutical industry's influence on how psychiatry is practiced have been guided by profitability in recent years. So we should be advocating for a standard which has better developments and guidelines for people. In 2020 to 2021, the budget recently signed by Governor Newsom a few years ago included $2 million to fund measures outlined in the report, aiming to help local governments, educators, industry, healthcare providers, community organizations, and everyday Californians do a better job in detecting and responding for suicide risk. Other offices, Assembly Bill 2112 created the Office of Suicide Prevention within the California Department of Public Health. So what should we do? By privatizing youth healthcare has costs to rise much higher than healthcare costs in other counties, yet health outcomes and life expectancies are still worse today. Healthcare is considered a commodity rather than a social right within the free market. So how should we be prioritizing our funds and our care? Obviously, the current system is not working. Obviously, a system that's relegated by the government has seen an increase in care, and we should be providing and allowing the free market to step in and take care of people more efficiently, better, have easier access to the free market. And open up these grants and open up the floodgates of funds to the private markets and allow them to intervene and help people where it's best seen at the grassroots. And so let the grassroots take care of the problem instead of from a top-down strategy. Thank you very much for tuning in, and let's all band together and let's try to stop suicide and save lives. As a veteran myself, I advocate saving lives.